Welcome Dr. Shetty to Editor Speak. Can a doctor go beyond the original consent while performing an intervention?
No, a doctor cannot go beyond the original consent while performing an intervention. The only exception can be an emergency.
So then what care should be taken while taking this consent before an intervention?
A doctor should anticipate some problems which may occur when performing an intervention and act accordingly in taking precautions. A doctor who takes consent for a diagnostic procedure cannot perform a therapeutic procedure. A doctor who takes consent for a laparoscopic surgery cannot perform a open surgery. In a recent judgment from a National Consumer Commission, a patient of suspected perforation of the intestine was taken into the OT after taking a consent for laparoscopic surgery. The laparoscopic intervention failed. The doctor performed open surgery. The patient had septicemia and the patient died. The court held the doctor negligent for performing an open surgery based on a laparoscopic surgery.
So then, sir, what should the doctor have done differently in this case?
This was a case of an intestinal perforation. There was always that chance the laparoscopic surgery may have failed. The doctor should have anticipated open surgery, taken the consent accordingly for both a laparoscopic surgery and an open surgery, explaining the reasons for the same, and then gone ahead and taken the patient into the OT. Not doing so was a very wrong protocol.
So now, sir, here it was an emergency. But what if it was not an emergency? What protocol should the doctor have followed?
If it is not an emergency, if the doctor has enough time, the doctor should have stopped the intervention moment the laparoscopy fails. The patient should have been brought out of anesthesia, taken back to the wards. A fresh consent should have been taken for open surgery, explain the reasons for the same, and then the open surgery should have been performed. And remember to document all the details in the medical records.
Thank you, Dr. Shetty, for your valuable advice.
Thank you.